Good morning, friends. Welcome to our next learning session and talking about the heart attack, that is myocardial infarction. I was suddenly reminded of a case which happened in 1966 when I myself was in the final year of my graduation, that is the MBBS. Our head of department of medicine suddenly developed a heart attack, that is myocardial infarction, and he was quickly admitted in the private ward under his own assistant, who was equally experienced doctor, basically from Amritsar. Friends, I will tell you, Amritsar was considered to be having one of India's most famous and good medical college, and was considered good for medical education, and people used to actually contest for going to the Amritsar Medical College. With that reputation, some of the staff was sent from Patiala and some of the staff from the Amritsar to run the Rohtak Medical College. We were lucky to get the training from both the experienced medical colleges, who were our seniors also in many respects. The patient did fairly well in the private ward under the care of this experienced doctor. For 2 weeks everything was okay, but in the third week the patient suddenly developed paralysis on the left side. His left side, the entire left side was paralyzed. We call it contralateral hemiplegia. Contralateral because it is on the opposite side, and it is complete hemiplegia starting from face going right up to the toe, which means there is a big area which is not getting blood supply. The treatment at that time was a conservative one. Most stress was given on the bed rest. The first week was totally in the bed. Even defecation, passing stool, passing urine was done on the bed. Care was taken to avoid bed sores, but patient was not permitted to move about. It was special care was taken that patient does not become excited or any emotional disturbance does not occur. Patient was given a small feeds of semi-solid diet so that it can be easily digested without exercising more stress on the heart. In the third week, as the patient developed left-sided paralysis, it was clear that there a clot has gone to the right part of the brain, and that is the culprit. We call this as embolism. Embolism means a portion of blood clot comes from a different place and lodges in the brain. This is called cerebral embolism. And cerebral embolism is the one cause of stroke. The others being thrombosis or clotting of blood inside the brain in the artery, that is called cerebral thrombosis. There is one type of stroke, or bleeding may occur in the brain or in the surrounding coverings, that is the other type of stroke. The quickest stroke is the stroke occurring because of embolism. It comes as a bolt out of blue. The thrombosis takes about period of about 24 hours, but hemorrhage takes about 1 to 3 weeks for complete stroke to evolve. So we knew that this patient has myocardial infarction, and the dead tissue, it forms a very good focus for the blood to come and deposit there, form a clot there, and a portion of this clot gets detached, enters the left ventricle, from the left ventricle enters the aorta, from the aorta to the arch of aorta, and then to the carotid artery, common carotid artery to internal carotid artery, and internal carotid divides into two, which I will show you in the diagram, the middle cerebral artery and anterior cerebral artery. Now I will show you at this juncture by diagram what these arteries are like. Now look at this diagram. This is the artery. This is, don't confuse this major artery. This is the back of the head. This is back of the head. From there only one artery is going, that is the posterior cerebral artery. But from here, this is the internal carotid artery. This is the internal carotid artery. And this divides into two, internal carotid divides into two. One is going like this. This is the anterior cerebral artery. See, this is close to this one. This is the anterior cerebral artery. Again, see, this is the anterior cerebral artery of one side, and this is the anterior cerebral artery of the other side. Now, this was the internal carotid which divided to give this artery, and then the rest it continues as the middle cerebral artery. This is the middle cerebral artery of this side. This is the middle cerebral artery of this side. Why I am naming these things is this anterior cerebral artery. Anterior means front. This goes towards the front of the brain, and the middle cerebral artery goes to the side of the brain. It supplies this area of the brain which is on the side. This is right in the center of the brain, like this. This is inside the brain. This, all these things what you are seeing is inside the brain, and this is the side of the brain, and side of the brain is all covered by this middle cerebral artery. See another diagram to understand this. Why I am stressing on this blood supply is because most strokes occur and different parts are involved, and for understanding those, this blood supply is important. This is the internal carotid artery coming from the neck. This is coming up here and divides into two. This is the middle cerebral artery. This artery is middle cerebral artery, and this is the anterior cerebral artery. This is the anterior cerebral artery. This was middle cerebral artery. This was the anterior cerebral artery. Okay. See the other diagram. This is the front part. This is the back part of the brain, and this is the lower part of the brain, and this is the upper part of the brain, that is towards the top of our head or skull. This is the depression in the brain which is called central sulcus. This divides the brain into frontal portion and back portion, front portion and back portion. This big portion on the front is the motor area. It is the principal motor area. This contains the centers for the movement of various muscles of the body. The most skillful movements get larger share, and less skillful movements get smaller share. Similarly, to the back of this depression, this portion is the sensory area. Here all the sensations, for example, you somebody touches you, or a pin is pricked on your finger, or you get an injection needle, all this pain, temperature, whatever is happening to your body is controlled by this area of the brain. Now here we have tried to show you more about the brain. See this area, right, starting from here. See, this is the elbow, this is the wrist, and this is the hand, and these are the fingers, and this is the thumb, You see, thumb is very important structure. It is getting separate, its separate here like this here. Thumb, fingers getting large area, hand is getting large area, wrist is getting. So much area is covered by hand because hand has to perform very important movements. So if your only thumb is involved, somewhere the problem is in this area. This area. If your fingers are involved, area problem is some in this area. If your hand is involved, problem is in this area. So this understanding is very important for the stroke which occurs. Friends, the myocardial infarction treatment is very difficult, but used to be very difficult in the past. Now a lot of new things have come up. The things keep changing. Newer things are coming. We did not hear of stents or ballooning during our undergraduation or even our post-graduation. But it was just after the post-graduation that things moved with great speed. The drugs like streptokinase, hyaluronidase, reticulase, and tissue plasminogen, they were all developed later on, and they help to dissolve the clot. Some are given by injection and the others are given by passing a catheter inside the artery and delivering the dose at the site of the clotted blood to dissolve it. The beta blockers were developed. They also help a lot to the heart. They lessen the work of the heart, and they also protect against the various arrhythmias of the which can kill the patient. Friends, when person gets heart attack, his myocardium becomes dead, and dead myocardium is a very good focus for the blood to come and clot there. That is it to settle there and form a mass there. But this mass is not attached to under surface. It is just lying on the dead myocardium, and therefore it is easily detached from there. It goes to the left ventricle, and from the left ventricle to aorta, from the aorta to the internal carotid artery, to the common carotid artery, from common carotid to the internal carotid artery, and then to the middle cerebral artery, and results in the hemiplegia. That is what you call as a stroke. The other drawback of lying down in the bed is the blood may clot in your calves, in the veins in your calf. There are big veins in your calf, and blood may clot there. And again, like heart clot, this clot is not firmly attached here, and therefore it may break from there to form an embolus and go to the right side of the heart and then to the lungs, and may cause a damage to the lung called pulmonary infarction, which could be fatal itself. The embolus, the cause of stroke, as I said, can be because of thrombus, which takes for about 24 hours to develop, or it can be hemorrhage or bleeding inside the brain, which takes about 1 to 3 weeks to complete, and it can be embolus, which is most quickest stroke. It occurs as a bolt out of blue, and patient falls, and you find that patient is paralyzed. Now the attempt is being made to avoid these complications, and that is why the early ambulation is done. In the case I am describing, in that era, the patient was given 1 week's complete bed rest on bed, even passing urine and stool on the bed, taking care not to develop a bed sores. In the second and third week, the patient was given bathroom facilities, but spending most time on bed rest. In the other next 3 weeks, he was allowed to sit in the chair and go to the bathroom and tend to daily needs, but no physical exertion was permitted. Similarly, no emotional excitement was permitted. Patient was explained, relations were explained, that no such thing happened that patient gets excited and that will raise the blood pressure and the complication or even infarction can also increase in size. So the point remains is that there was hardly any treatment available at that time, and we had to manage the patients like this. So friends, next time we will meet with some other interesting case, but you continue to extend your support by subscribing our channel and commenting on the video. Thank you very much.